to LA After Dark with your host, Abby Cubey, only on LA Talk Radio.
Come on, let's hear it. Liven up.
He always does that to me.
Just a little extra applaud. Well, welcome everybody to
Hi, Steve.
LA
Hi,
After
Kendall.
Dark.
Hi, Abby.
Thank you.
Abby Cubey and myself, Moe Abourched. And tonight we have two amazing gentlemen with us. And we're going to talk all about healthcare. We have Mr. Kendall Lockhart and Mr. Steve
Cantrell.
I was getting there.
That's
I was
close.
getting there. I just want to pronounce it right.
Okay, I'm just making sure.
I would never mispronounce his name. He's bigger than I am.
Yes, you should be scared.
I don't pick on guys bigger than me.
That's smart.
He'll
Kendall
beat me
is-
up.
That's
Right?
good.
Yeah.
Kendall is the CEO of Moe Care, and Steve is.
So I'm the Chief Development Officer of Pioneer Medical Group, and I'm the advisory board of Moe Care.
Wow.
Me, you care. I like it.
Thank you.
How did you
does-
come up with that name?
It's a communication company, right? So it's about me, it's about
You.
you, and
Care.
We
was
care.
us, exactly. So it's a
Care.
There you go. Care, love.
Me, you care.
Care.
So I'd have something short and cute. So there it is.
I like it.
No, I like it. Actually,
very catchy.
it speaks a lot. You
Yeah.
know, me care about you. Me, you care.
You,
care
you
about
better.
Steve, before we start, I just want to say something to you. I've been looking at you, and you have a little sparkle in your eye, right there on the left eye, and I was just wondering what that sparkle was all about.
You know, it's all about being here.
Is that what it is? It just gives you a sparkle in your eye.
I'm excited to be here. It just puts a sparkle in my eye.
That's
You're
not
sure
what
it's
you
being
told
here?
us.
It's not Abby.
You know, Abby helps.
Abby helps a lot.
That's not what he said earlier, right?
No, he
Off
did say
cam?
Abby.
No, I'm kidding.
He said you are the sparkle in his eye.
Oh. Now we're talking.
Gentlemen, we're here to get educated about healthcare, and I was told you are the authority right now on Me You Care,
Yes.
right?
Well, that's true.
And the healthcare system. And I know I'm like a 4-year-old when it comes to healthcare. I really know nothing about it. I haven't been to the doctor in a couple of years, but we'll talk about that later.
Well, you're just like everybody else.
Yes.
Because I don't know where to go. I can't even go online and pick a doctor, and it's so complicated and it's so convoluted.
Right.
So help us understand it.
Steve, you want to take a crack at
Well,
sort of
I'll
what
take
the
a crack.
issues have been?
So, healthcare is confusing not only for you, but the majority of America. People don't understand their health plans. They don't understand their benefits. Part of the problem is healthcare is broken, and it's not a Republican or a Democratic problem. It's just a systemic problem that, it's broken. Providers want to get paid more. Health plans want to make more.
Consumers want to pay less.
Consumers want to pay
Yes.
less. People are dying because they're not getting appropriate care, and it's the whole system's broken. And I think we're all wanting something. The California wants to give free health care to everybody. The Republicans want to take away health care, but at the end of the day, it's broken. The one thing that really should be done is all health products and all health plans should be taken off Wall Street. Whether it's a hospital, a pharmaceutical, or a health plan, they should be removed from
Well,
Wall
that's
Street.
what I was going to say. It's really, healthcare used to be about healthcare. You take
Right.
care of the people, right? You make sure that when they're sick, they're taken care of, and if they're not sick, they stay healthy. But now it's become more of a business.
Yeah,
really.
I think that's one of the
It's
biggest.
unfortunate, yes.
Yeah, I think that's one of the biggest points that you could start with from what we're talking about is, and my background, as you know, was I came out of the media business. I came out of Disney and ran the interactive product development, and part of what you learn in that is that you're always dealing with human emotions. And when I moved into health and consumer health, one of the things that I found out very quickly was this is, as we all know, this is one of the scariest things in your life, right? This is a frightening thing to suddenly go, I have something, or I was diagnosed with something, or my mom was diagnosed with something. Suddenly your world just flips, right?
Right.
And to your point, all you're thinking about is not the business, not what it may cost right now. You're thinking about, I need to help this person or help myself get healthy, right? And there's this interesting study that came out just a couple years ago from one of the big foundations that 82% of people in America, patients in America, want a closer relationship with their doctor, even over lower costs. We always think, oh, American consumers, we want to just lower our costs, let's go get the latest Costco thing or wherever it is, right? It's not true with healthcare. What they're concerned about is that I have a relationship with me and you, with somebody that I can trust. And so the broken part has gotten in the way of that, and that's really what
of the relationship.
Of the relationship.
That's
There's also and people don't realize. So we all go to the doctor. Some of us go once a year. Not all of us, but we all try
One
to go.
goes
every
4
5
years.
years.
Every 5
But I'm
years.
going to tell you a story why that is, honestly, and I'll tell you a little story after you're done.
So most of the people go once a year just for a checkup, a physical, just to make sure the doctor to tell you you're okay. The problem is it's the end of life or when you're sick. So the last part of your life, you spend 90% of your healthcare dollar. So the last 10% of your life is where the most of your money is, and that's where you're spending it. And with the new plans and the new regulations, with these high deductibles and co-pays and all that, well, before, you got to it and you just had the copay and you were going to pass away and it wasn't going to be too bad out of pocket. Well, now $10,000 out of pocket when you don't have $10,000.
Right.
So it's really.
So what do they do in that case? Do you throw you out to the wolves? I mean, when you don't have the money, where does the healthcare system come in?
You get lesser care.
And that's what it
Pretty
is.
much,
So
yes.
it goes back full circle. It's a business. It's not really healthcare.
Well, or it becomes weirdly enough, a very expensive business for the rest of us to help those who don't have health insurance. Why? Because guess what people who don't have health insurance do? They go to the emergency room.
Right.
That's one of the
The
most
ER.
expensive places to get care, but you have to, especially in a county hospital, at least in California, you have to accept that patient, right? So if you have a flu, or I don't know why, the one thing you might go to the doctor for might be I have an upset stomach or whatever it is, right? So you're not going to go to your $60 little local, emergency care or healthcare situation clinic. Instead, they go where it's free. But that's $1,800 if they've gone to an emergency room. Well, that comes out of the rest of us, right?
I think it gone up. It's gone up
Probably
to
more.
2,200. Yes.
I think you're probably absolutely
I
right.
spoke to someone I know at not CAC, but LA County Hospital.
Yeah.
Yes.
Yeah.
It's about $2,400
Yeah, I mean,
to
you
go
guys
to
are
the
both
ER.
right. You're up.
And so the costs are significantly more. There's been proposals submitted to the state that showed ways to cut $2 billion out of the budget by setting up local, not urgent care, but we'll call them same-day illness clinics, and really reach out to the population and say, hey, don't go to the ER, go here. But it was rejected by the state. They didn't want anything to do with it. And then it gets back to the business.
Right.
The business part of it are paying the politicians to make sure that certain laws don't pass.
Well, we're not going to get into politics.
I'm not-
we
this-
promise.
it's-
No,
it's
we
factual.
promise. But it is a lobbyist business.
Yeah,
it
that's-
really is. As long as you lobby your politicians and you get them to do what you want them to do, then you get away with it. And that's the broken part you're talking about.
It's broken.
Yeah.
The whole system is broken, and everyone keeps saying single payer. And I like the single payer idea, but the problem is, do you really trust the government to run anything? I mean, they can't even run Medicare. They can't run, Social Security. California, the 7th largest, country?
Country, yeah, pretty much.
I mean, we could be the 7th
Yeah.
largest economic power in the world, and we
Right.
can't even balance our budget. So how are we going to hand over health care, which is very personal, very intimate, and say, okay, we need you to advance it. We need you to do some really neat things to help combat everything. I mean, it's just not feasible. And I think this is where Me You Care comes in, because Kendall and I met 6 years ago, And we've been working on this together for 6 years and developing it and really trying to do it. And this is where it gets in, because it really addresses a lot of the need in the rural communities, the communication, and this is a direction that healthcare needs to go in order to do it. There's a shortage of doctors. Why? Well, doctors, to get out of medical school, I interviewed one a couple weeks ago. They're $500,000 in debt getting out of medical school,
Right.
and they have no way to pay it back, and they're looking, a millennial, for free ride, someone to pay it for them, and it's just crazy. You're sitting there going, okay, you owe $500,000, you're going to pay it off over 30 years, so you're going to pay X a month for 30 years, and it just doesn't pay like it used to. And so we're kind of in a dilemma. And
one of the other key things, though, is the definition of health, right? And it kind of goes to the point that all the money gets spent in the last 10% of your life, and that tells you literally that you could be doing things earlier in your life, right? They call it preventative health care, right? Or wellness, or whatever. Just
early detection.
Early detection, keeping yourself out of the hospital. And so one of the things that I learned in the sort of the family dynamic, what's called, and I don't care how you define your family, the people that you love and who love you, however that's defined, right? It doesn't literally need to be your actual blood family, right? Having those people involved, in your ecosystem, right? So that someone says, look, you ought to go to the doctor more often, or gosh, you're really stressing out about work these days. I think we need to take up walking, or take up yoga, or do something. You realize there's so many things that we could be doing for each other. That if we could communicate about it, if someone could sort of give us some input into us, give us a little video on what to do, how to do things like that. That literally we could really change the dynamic of healthcare without having to fix all the big problems that are systemic, to Steve's point.
Right.
So a lot of what I'm interested in and why we created Me You Care was, to sort of what's going on with mom. I just always use that as the little example. All the kids
Because we all
wanna know,
love mom and we care about mom.
What's
We make
good,
sure
so whether
she's
that's
good.
dad or brother or son, doesn't matter, but you get the idea. What's going on with mom? How can we help her stay healthier? Right? And that is great for math, right? That's great for all of our healthcare system, but most importantly, it's great for mom, and it's great for us. And so what is it we can do together to sort of keep ourselves healthier and communicate more clearly with each other? As you know, medication is one of those big things. 80% of people don't take their meds properly.
Yeah.
Right.
Crazy number.
Even I am. I forget.
Or you get tired of it. Or I'll tell you,
Yeah.
with people who have chronic conditions, there are side effects. And guess what? After week 3, you're tired of having, diarrhea or
Right.
whatever
Oh,
it is,
yeah,
right?
yeah, yeah.
You're like,
That's true.
I don't like this stuff
Well,
anymore.
one of the other problems is the people on Medicare, and the seniors. It's not that they don't want to take the pills.
Yeah.
They can't.
They forget,
They
or-
can't afford the pills.
Right, there's
So
that.
what they
Or
do
they
is
forget.
they cut them in half.
Right.
And so
Right.
they're trying to lengthen it, and so
And then it doesn't really do what it's supposed to do.
Well, it does just
Yeah.
the opposite.
It does
Think
the
of it,
opposite.
they always tell you finish your antibiotic thing
Right.
because otherwise it comes back kind of problem. Well, you can imagine that in multiple settings.
But
right?
the pharma industry also, which is
Take 'em
the
off
story.
Wall Street.
Take them
Take
off
'em
Wall
off Wall
Street. But
Street.
pharma
Yeah.
industry is a big business industry,
is.
right?
It's huge.
So when
Yeah.
when I started in healthcare, way back in the golden ages, it represented about 14 cents on every dollar. Which okay, not bad.
Yeah.
Now it's 114
Well,
cents
now
on every dollar.
now it's running significantly higher, and that's the major part of it. And with the commercials, the designer drugs, and all that, they're really driving the price up. And in the United States, we cover the profit of all the health plans.
Right.
Because the other countries negotiate a price, and we don't. And I think, once again, the lobbyist and the business side of healthcare, it's just driving up costs.
Well, let's we're going to dive into that, but before we do that, why don't we just go back a little bit and Kendall, tell us a little bit about you. I know you came from
Yes. Sure.
Disneyland,
Yeah.
right?
Disneyland.
Kind of.
Disney, not Disneyland.
Not literally.
It's a big transition.
Disney.
Yeah.
So I always say, it's Disney meets healthcare, right? Which is
Right.
kind of
Yeah.
a very new idea, right, in some sense. And yet, when you actually think about it, actually, where healthcare is going or where we're going as people, because finally it's people, right? It actually makes a lot of sense. And so I actually was a documentary filmmaker, and then I went to Disney, and I was asked to be the worldwide head of product development for a new division, which was anything that moved on a screen. So it's all the interactive stuff, right? So you literally realize how are you going to keep a 5-year-old's engagement with a screen of some kind, whether it's a big screen, a little screen, doesn't matter. You know,
And that's a big job, by the way.
it's a
Yeah.
big job to
Huge
keep
job,
a 5-year-old engaged, right? And so I had a wonderful time. Then we built a huge division, did a great business. I love Disney, fantastic place for a creative person to have a career. But I found a time when I wanted to do something in addition. I wanted my life to sort of go in a more meaningful fashion for me. And actually, I got very involved with yoga and integrative health here in Los Angeles. And as a result of that, started to look around at consumer healthcare. Where was wellness going? Where can we do things? And could I bring interactive media into that space? And so I did. I actually went to a company. We built it out as being one of the third most visited websites for healthcare, for integrative health. But what I learned during all of that was two really important things. One was that consumers are just like 5-year-olds. You can say it's really good for you to go to the gym, and they go, uh-huh. And
Very
they don't
true.
go. And they
And
don't
they
go.
don't go.
And they don't go.
They don't
Yeah.
go.
I'm
So
guilty of
where
that.
everybody's guilty of that. So behavioral change is just as difficult for an adult in healthcare as it is for a kid on a little screen. So I realized suddenly what I had learned before was actually going to be really applicable, which is how do you keep someone involved, right? Second thing I learned was you will do things for a loved one in health you won't do for yourself. And what I mean by that is you have a
Very
child,
true.
you will do anything for your
Yes.
child. Anything
That
for your
you
child.
forget about
That you
yourself.
forget about yourself.
Yeah.
The corollary to that is if your child asked you to take better care of yourself, you would.
Yes,
And so,
absolutely.
Oh, that's
right?
interesting.
No, this is a
That's
really
a very
critical. I've
interesting
watched
point.
this
Yeah.
in life, which is if you go, Dad, you promised me you'd stop smoking 1 cigarette less, or whatever it
Right.
is, some achievable goal,
Right.
right? Then suddenly Dad's like, well, okay, honey. And
Yeah.
that's, your doctor can scream at you, you can watch all the public service ads on the world, and I've watched, they have almost no effect. But a loved one can change the dynamic.
My 3-year-old got me to quit smoking.
There you go.
She kept after me, Dad, don't smoke. Dad, don't smoke. Why
There
are you
you go.
smoking? Oh, it's horrible. It's smell. And you know what? It worked.
There
My
you
wife
go.
bugged me about smoking for years, in one ear and out the other.
Yeah, but-
it's true.
You don't listen to your ex-wife?
No, I did not listen to my ex-wife,
That was the reason.
Do we
that was the reason
and
you're
that's
an
why
ex.
she's the ex.
Do we have a little understanding of the X?
Yes. Every time I'm learning.
So when you take that, a couple of those key learnings, and then take it into, okay, what can we do about it, right? I realized that the concept of communication was really important, the idea of bringing in everybody into the discussion, so family members, home caregivers. There are 40 million unpaid home caregivers spending 20 hours a week taking care of a loved one in the United States.
Wow.
Wow. So
That's
talk about
crazy.
an untapped group of
40 million?
million
Wow.
spend 20 hours a week
Unpaid, taking care of a loved one. But they do it out of love. I
There
mean, they're
you
not
go.
looking to get paid.
There you go.
Right.
But so who's helping them understand what's going on with mom? Became one of our drivers, right? Like, okay, so we built an interactive, obviously,
Right.
multimedia and mobile communication platform, an app, essentially, right? It's deeper than that, but it's an app. But it allows anybody to share a video, a photo, a voiceover on top of a photo, music, anything that you need to share, a document, an assessment, surveys, all sorts of things. You can share them, and anybody can be included. What's really important is it's HIPAA compliant. It's secure. So unlike WhatsApp or unlike Snapchat or something else, which is, it's secure in the sense they have secure platforms, but it's not secure in a health sense, right?
Right.
This was designed to be hard-coded, secure, so you and I would never worry about a picture of mom getting out in the world, right? If we're showing her a picture of what's going on with mom, right?
Right.
So we took that as a design, we included everybody that needed to use it can use it, and then we've taken it out into the marketplace and sold its use, licensed it to health companies, right? So consumers use it for free, but health plans and
Pay for
doctor
it.
groups and stuff pay us in order to have all their doctors use it and stuff like that. So you can talk to your doctor with it, or you can talk to just your family with it. And so it's an idea about let's stop missing communication in
Right.
the world,
Yeah.
right? Because
Right.
when I don't know if you've been to a hospital all lately, they talk to themselves. If they want to talk to somebody outside the hospital, there's no system to do that, right? And if you want to talk to a different hospital or a doctor who you might want to talk to over there, there's no way to do that. There's no, it's all siloed, right?
Right.
We're like, well, that doesn't help us stay healthy. So this idea was to sit on top. We're not replacing healthcare. We're sitting on top, kind of like a Google app, right?
Right.
Like Google business apps sit on top of the world.
Educational and
Same thing.
communication.
Communication being the key
Improving.
thing.
Communication, right.
We're improving the quality of care.
Right.
Yeah. And so it's used for care coordination, which means back to the what's going on with mom. Well, it turns out in the healthcare world, that's a lot of money. It's really important because if I can keep you out of the hospital, my healthcare company does better financially. Of course, we love that because it's a good business, but why we really love it is it keeps mom healthy, right? So you kind of have two wins is the way we think about
Right.
Yeah, it's a win-win.
Well, and where healthcare is, I mean, it's funny, the insurance companies are doing everything they can to not be in the insurance business. So they're delegating risk to all the medical groups and the doctor groups and the hospitals and all that, saying, okay, we're just going to take money off the top. You take care of everything else, and if you get a bad patient that's going to cost you a lot of money, oops, it's your problem, not ours.
Right. So it's
Right.
a big math problem for these
Right.
companies.
But I also think that the healthcare system in itself is like a foreign language. I mean, they don't really educate. Even when you're sick and you go to the doctor and they, they'll tell you a very brief description of what you may have or may not have, but you're looking at it, you're like, I didn't understand a word you
So
said.
great example. I'll give you two, totally on point. I'll give you two real world examples. One is, you've all probably done this, you go to a doctor's appointment, something's diagnosed, something's said, you've stopped listening after the first,
Right.
what have I got?
Right.
Right? You go back home, your spouse says, so what did the doctor say? You're, I don't know. I've got something.
He used a word this big
Right,
that
because
I can't even pronounce.
Well, or even if they don't use the word, you've stopped listening,
Right.
which is what your
Right.
point
Right.
was. You're like freaked out, right? You're like, that's again, this is why I call it Disney meets healthcare. Let's go back to human emotions. This is the most personal human thing that goes on in your life, right?
Is your health.
Other than your relationships,
Yep.
is your health.
Your health.
And it's super personal, right? It's
Right.
my health or my child's health.
Yeah.
Super important. So it's so emotionally laden, it's so full of fear and things like that, that we have to remember that. So one of the things we do is you can take a video message of what the doctor said, or a video message can be sent back to you 3 days later or 2 days later and go, here, honey, here's what I've got,
But-
or here's what we're supposed to do about it.
But will the doctor really let you take a video message of what he said?
That's a
With all
that's-
the, you know what I'm saying, with all the lawsuits and all the issues,
So-
and
so
they don't want
let's
to be
talk about
caught on
that.
Let's talk
record,
about that.
right?
Are the
Med-
hospitals using this now?
Yes, and so great question. Some doctors might be uncomfortable with that.
Right.
True.
They don't want to be caught on record
True.
saying something wrong.
But I will tell you, the best doctors and the chief medical officer of every one of our big clients, we have very large clients, absolutely thinks it should be okay. Why? Because to them it's the opposite. It's proof that our doctors did the right
Right.
thing.
And
they're
That's the
doing
way
their
I would
job.
look at it.
But,
Hey,
but your point's correct.
Yeah.
And it shows if the patient is compliant or not.
Right.
So if the patient didn't watch it, or if they watched the first 10 seconds and stopped, it shows non-compliant. So when they go to sue the doctor because they didn't do it, it shows the patient didn't follow the instructions and didn't do what he was supposed to do. Therefore, med mal companies love this.
But the positive side of all this is a picture's worth 1,000 words, right? We all could do better by saying, how do I clean a catheter if you have a patient, a family member with a catheter? Well, a 30-second video can show you
We'll show
that,
you, yeah.
Right.
And it can show you that in any language because a video of showing you how to clean a catheter doesn't even have to be in a language. It's just a
just
video.
watch it.
Video.
Right. It's visual. It's
Exactly.
visual.
Visual.
Exactly.
How long of a video can you send?
You could send a 10-hour movie with ours if you wanted to, but
Wow.
but I mean technically, right, from the technology point of view. But your point where you're headed, I think, is YouTube and everybody's showing this that
Yeah.
90 seconds or less is all we're interested in watching.
Well, that's
Right,
true.
right.
That's our appetite.
Well, that's the
today.
For me,
attention.
only
Yeah,
7
the attention
seconds.
There you go.
span.
You're a Snapchat girl, so
Yeah.
that's 7 seconds. So
Let's talk about, and I know Disney meets healthcare,
Healthcare.
and I know that's no Mickey Mouse job at all.
Yeah.
Right?
No, it's not. It's
no
not.
pun intended.
no pun intended.
No pun intended. I want to talk about the big elephant in the room.
Yeah.
The big elephant in the room. What's going on with Obamacare and Trump administration? What are we doing? Where do we go? And I mean, I think the only people that are suffering with all this is the consumers,
Right.
are the people.
Yeah.
And I just want to follow up on that. When Obamacare was created, And it was what, a book this thick?
Yeah.
Right?
That no one read.
1,200 pages.
I was just going to say,
Yeah.
who read that?
Nobody.
No one.
Exactly. So how do we know what's in it, what's not in it, and how is Trump administration correcting it if we don't know what's in it?
So let me. I'm going to give you the consumer perspective and the human patient perspective because that's what I care about and where I come from. Steve has much more experience with pluses and minuses side of it from a business and a healthcare point of view. But I think it's really important at one level that we understand a couple of things that came out of it that. Even irrespective of the 1,200 pages or whatever, there were two really, really important things. One was pre-existing conditions.
Right.
Who the heck doesn't think that was unfair for as long as you've known about health care, right? You smoked a cigarette once in college, and now you have breast cancer at age 42, and somehow you either didn't tell me that, therefore we're denying you coverage, or you did tell me that, therefore we're denying you coverage.
Yeah.
Either way.
Right.
Right.
No one in the world thought that was correct. But it was the law of the healthcare land for as long as I can remember. That got changed.
With Obamacare.
With Obamacare.
Obamacare.
It wasn't a law, it was an unwritten law.
It was a policy of every health insurance
Just
company in America.
Find it in the book. It wasn't there.
No. But didn't every health insurance company
right.
use that?
Yes.
Yes.
Yeah.
Thank you. So
Pre-existing conditions.
Yeah.
Right?
So-
When you went for renewal,
Yeah.
for some reason
Bye-bye.
you weren't
Yeah.
renewed.
Right.
And yeah.
So to me, Obamacare did a couple of really important things like that, right? And then other people wanted the 26-year-old, up to 26-year-old children still being able to be insured, things like that. And then they also took out lifetime caps, right? There was a $2 million cap, right? And that was, you get into a serious cancer situation, and you can go blow through $2 million and really quickly, right? So these were good things in my opinion. The other key thing from a social point of view that I really respected about the effort and what it did do is to say, what is a healthy society if we just sort of by fiat say, well, forget 30 million people. They don't need health care. And I don't think that makes a healthy society. I don't view that for public education, and I don't view it for health care.
Well, it depends on where they are in society, right? If they're middle class to upper class, we care. If they're not, we
This
don't
is my
care.
point.
That's
This is my
exactly
point.
the
That's my
point, right?
I don't
We
think that
away.
makes for a healthy society to have people that we just let go.
The poor are disposable.
Right, exactly. The elderly and the poor.
Especially the elderly poor.
The elderly poor.
They're disposable. You don't need them. Just get rid of them.
So I respected that about Obamacare. Forget all the business problems there are, and Steve can talk about them. But any system that doesn't want to continue those things and respect that this country is better off by taking care of its poor and better off by having fixed those two problems in the healthcare law, I don't think is the proper way to go. And Trump Care did not try and fix those things. And so I think, so that's just my human viewpoint. Now Steve will talk about
Steve,
What do you think?
So, there were some positives, as Kendall said, in Obamacare. There were a couple of outcomes that I think were good for healthcare. The making everyone pay and the full subsidies. One of the things that I've learned, in healthcare is if you don't charge a copay to go to the ER, you're going to frequent the ER. And that's what happens in the Medi-Cal and the Medicaid community. There's no copay or a really small one, so it's cheaper to go to the ER than it is your doctor. So where are you going to go? You're going to.
That's
so,
very true.
So I think when they did it, no one really looked at healthcare and how it operates. They just had the politicians that said, this is what we're going to do, and we're going to do it because that's what we got to do.
And like sheep, we followed.
Yeah. And
right?
so what happened? I mean, Arizona had an average price increase last year of 35%. So we're seeing record increases to offset because the people who joined the Accountable Care Act weren't the healthy ones. They weren't the college. I'll pay the 1% penalty or the 2% penalty because it's less than the premium I have to pay.
Well, Steve, wasn't one of the big assumptions that was really a silly assumption was that somehow younger, healthier people in America were going to go get insurance
And
just
that's-
because it was available.
Well, and that was that.
Right?
That was
Whereas
the
I think they
penalty.
just said no.
Yeah.
We don't need
yeah,
it. I'm
right.
still young and healthy. What
So
do I
Yeah.
care?
I remember when I was young and dumb.
You
and
never thought
I
about
didn't-
insurance?
I didn't need health care.
Well, yeah, me too.
Right?
I mean, it's
Yeah.
like I don't need health care. What
So
do
I think
need it
that was
for?
an assumption
And
that was really like boneheaded.
and
about
that and
it,
that
you know?
that was going to be the crux for paying for it.
Right.
It didn't pay for it.
It didn't happen.
So what's happened is healthcare has gone up.
Right.
More sick people have joined, thus skewing the pendulum the
Yeah.
wrong way, and so there was no offsets. It was also this whole Accountable Care Act, and the underlying issue was it was moving towards a single payer. So that was
So explain the single payer to the audience that are listening so they understand what that means.
So you pay taxes out of your payroll.
Right.
Everybody. Doesn't matter whether you're make $10 an hour or you make $1,000 an hour. You're going to pay a portion,
certain amount,
a certain
right?
amount out of your taxes, up to probably 50 to 60% of what you make is going to the government.
Wow.
Yeah.
So just do like Canada,
Right.
Denmark, and all that. You know, Denmark, between 45 and 60% of everything you make goes to the government to pay.
And
for-
everyone's covered though.
Yeah, everyone's covered to
Yes.
pay, but
I think we should do that.
no.
Well, no.
The weight.
You don't want to do
There's
that.
there's a lot of problems with that. So that's kind of what this was kind of going towards, basically making the whole country Kaiser.
Right.
Okay. So okay.
Wait. Elaborate.
Okay, Kaiser's a multidisciplinary plan. It's an integrated delivery system that the hospital, the medical group, and the health plan are all one. Kaiser's innovative. I'm going to give Kaiser the.
But they also provide
because
great.
They provide.
Right?
They're building their own schools. They're making
Well, that's the thing.
their own doctors.
They're,
Pretty much.
they're
It's
doing
a
they're
smart
doing a
move.
medical school, and doctors who go to there are going to go for free. They just got to work for Kaiser for a few years, and after that, Kaiser can decide whether you're going to be a partner or not, and then whether you want to continue.
I think that's very innovative.
I think that's
I
phenomenal.
think that's amazing.
They're going to kill the market. I mean, they're going to win.
Why aren't more hospitals or health givers doing the same thing? Why aren't we incorporating the system in such a way that you do make the doctors a partner and you do give the education for free to where you're not in debt like you were talking
so
about earlier?
one of the dilemmas we have is, and I've tried to get hospitals and health plans and medical groups together to kind of sit and talk this out and exclude Kaiser. Okay, and the reason I want to exclude Kaiser is we're all fighting each other for the
Right.
same patient and beating each other up and doing everything we can for that same patient. We're not trying to improve quality.
Is it the patient or the dollars?
Well,
Well,
the dollars.
It's the dollars.
It's ultimately,
Right? It's ultimately the dollars.
It's ultimately the dollars.
Right.
So we're all fighting for those dollars and amongst each other. And the only person or only group that's winning is Kaiser every single year. They're increasing their membership. And when they did the Accountable Care Act and did the Medicaid program, you know, Kaiser, the executives at Kaiser helped design it. And they did a phenomenal thing. They didn't include themselves in Medicaid. So they said, we're going to do commercial and senior, and then the Medicaid stuff, we'll let everyone else fight over it.
Fight over that.
And so
Smart.
they're smart.
Smart move.
They're doing really well. They're smart. They have good leadership. And I think what the rest of the industry, I mean, we're all out there trying to do everything we can, and we're not really distinguishing ourselves anything different than each other, and it's really hard to manage. You know, if we don't have something to set us apart and talk about the better care and deliver better care, then, you know, we're just like everyone else. And that's where better technology, better communication, the relationships amongst each other have to be cordial. It's pretty interesting. I think we're
You mean between the health providers?
well, I think between the providers, I think between the groups, the hospitals, we have to communicate. And we don't. We fight.
So this is where MioCare come in, right?
I think so.
So how do people use MioCare?
So they use it in a couple of ways. One is if you were a family member, right, you can use it to communicate with other family members, and you don't even have to involve your doctor, right?
Right.
And so you guys could send a video of mom, and so whoever's ever taking care of mom, right, could, and I'm using mom generically, any patient, any loved one, you take a little video of how mom's doing, or you take a photo of her knee or something like that, and that can be shared with family members or a caregiver or back to the doctor or a care
So
manager.
doctor, if I'm a patient, I'll just send I'll send a video to the doctor.
Exactly. And the doctor, same way on the other side, can say, here's some information for you, or I wish you'd come to an appointment. One of the big things, and this is where I think a differentiation for Kaisers and others can come in, is personalization. It goes back to this idea that I want to talk to my doctor or the nice discharged lady I met at the hospital who knew my name, right? I don't want a generic relationship with the healthcare system. It goes back to the survey I quoted, right? 82% of people want a more personal relationship. So a video from my doctor or a video from my nurse that was really sweet to me at the hospital, I'm going to listen to that. I'm going to pay attention. I'm going to think she cares about me because she took 10 seconds of her time to do a selfie.
Yeah.
Right? And I'm like, okay, that's Barbara. Oh, she was so cool. She really helped Mom.
Yeah, listen to what she's got to say.
Exactly.
Absolutely.
It's talking about rehumanizing. I don't know if that's even a word.
Yeah.
But it's talking about rehumanizing healthcare. Right? It's everyone longs for the concept of when a doctor came to the house and said,
This is very, very smart.
how's Barbara? Right?
love it.
You gotta. It's why you use media today, right? Everybody who's young and
personal.
smart uses
To communicate, right?
Exactly.
It's sure.
Personal.
So it's bringing modern sort of media technology into a world that really needs some rehumanization, and I think that's the key differentiation.
Well, when we started, I said I haven't been to the doctor for a few years.
Yeah.
I came back from a trip, and I was really, I caught a bug overseas, and I came back, and I was really ill, and I thought I was dying. It took me a few days to book an appointment with my doctor. I went. I waited for an hour in the room for him to see me, okay? And he walked in, and I swear to you, he didn't touch me.
Of course.
He didn't do anything. He looked at me, and he goes, oh, yeah, you might have this bug, but here you go. Here's a prescription. And he was in the room for a total of 4 minutes.
Yep.
Yeah.
And I looked at that.
$161.
Well, I don't know
Well,
what.
probably
Yeah,
300
at that
now.
time, and I'm like,
Yes, 300 now.
and I said, but don't you want to touch me? Don't you want to feel it? Look at my mouth, look at my ears. He's like, nah, you're fine.
Yeah.
That was a day I decided I don't need the doctor.
Right.
Seriously, there was no human element to it. It was really more like move him in, move him out, step in, 2 minutes, next patient.
The business.
So two things on that. One is
It is, and I didn't like that. I felt really I didn't feel cared for.
You didn't feel good.
Yeah.
I didn't feel cared for.
So 2 things interesting, and tell a similar story in a second, but one of the things that MIU does is you do not have to be at the doctor. This is the great thing about remote media, right? It helps if you're the doctor, but you could be anywhere. This is back to rural care or something. There may not be a doctor. We have a project with a company that has nephrologists, people who handle people with renal disease, dialysis, right? And the patients are in Belize. There aren't any nephrologists in Belize, it turns out. They're here in Arizona. So they use MIU to actually communicate with the patients and their caregivers in Belize remotely. They take photos, they do selfies. How's your diet? How's this going? It's a relationship.
Very cool. Right.
So there's
I was gonna ask that if this works like globally.
anywhere in the world, because again, you're using it. So whatever you want to type, your language to someone else in their language, you can do that. So
Or
you can
speak
use
it.
Yeah,
It's
have
language
speak it.
agnostic.
Yeah,
That's
so
really interesting. So if we have people overseas, relatives,
Yeah.
that want a second opinion
you
here,
got it.
Yeah.
so
You
they
got
can
it.
use
They can take a
MIU
video,
Care, take a video, give them their diagnosis
Yep.
of what the doctor said over there,
You got it.
Yeah.
and somebody can look at it
You,
here.
you can also do attachments, so they could
That's
actually
very
they could
cool.
actually send the doctor's notes
Right.
in the MIU. The doctor can review it, and the doctor said no, that's not what it is. And they
Because
can-
and so in a first world sense, no one wants to sit around and wait for 2 hours in the doctor while he's late or she's late, right? There's that reality. So I'd like to do some of the stuff from my home. But in the global sense, with an underserved world where there aren't enough doctors, now you can start to say in Africa and Asia and places, you can actually start to have remote care and bring specialists in, that kind of
Right.
thing. But I was going to tell a quick story that when I was making documentary films, one of my films was called Touched. And it was, the premise for it was about people who hadn't been touched at very important times in their lives. And I had met this woman who had a mastectomy, and I thought I would love to know, and she was married, and I wanted to know how she and her husband's physical relationship was, not sexual, but I'm just saying physical.
Right.
Was it different? Was it? I thought that was going to be the vignette, right? Turned out that was part of the vignette, but the real story she told me was very similar to yours. She said she'd been diagnosed. She went to over 20 doctors over an 18-month period. And you know, having breast cancer and waiting 18 months, not a good idea, right?
No.
Praise God, she's fine, right? She was fine after it. But it was and the reason she never said, go, let's do something about it, is because the doctor would walk in and go, yeah, and look at the chart.
Right.
Yeah,
Not even look at her.
Not look at her and go, and then I go, yeah, you need to do this. And she'd be like, felt like,
touch me.
who are you? You know?
Right.
Finally, a doctor at UCSF, who I put in the film, I had their relationship, actually literally brought him in as a partner in the film. She said he came up to her and said, duh, and did the touch thing. And says, we really need to do this. She scheduled the next day. So again, look to your point exactly, which is it's about you got to show that you care about me.
So can we give you a tagline for me, you?
I love it.
Okay. Yes.
Right?
Touch me.
No,
Touch me.
No, we touch you when you need it.
There you go.
Yeah.
We touch you when you need it.
We touch you when you need it.
There you go.
Hello, I need to be touched.
Not sure we can charge you that legally.
Charged legally.
Well, you might. It's a medical thing.
It's
a medical thing.
Absolutely. It's
Kendall.
therapeutic.
Very therapeutic.
Kendall, where do you see the company going?
So
What is the future?
So we have two aspects. It's a great question. I really appreciate that. There's two things. One is obviously to go deeper into the core healthcare company space, enterprise space. We're a small company, so we do better by partnering with large companies that already have 20,000 doctors or 3 million patients, right? So our clients include Anthem and Healthcare Partners here in California, and so that's really good business for us. So we're always after more of those relationships. But the other piece is the one kind of where we are headed, which is we're talking about, is we would really love a lot of those 40 million home caregivers and their family members to start to use it.
Right.
And it's free to them, so they can just go to Me You Care and download the app and start to communicate with each other. So that's a really cool thing, because we would love to see globally that people just started to use it for sort of that purpose. And so we'll make our money over on the corporate side, let's call it, or the healthcare side, where they need to save costs, and so they use it for hardcore cost savings, care coordination. But with it, we also have a mission, which is to make the world a healthier place. And so,
what's your reach out? What's your reach out to the providers and to the consumers? How do you advertise Me You Care?
So
How do you get it out
we
there?
We don't on the consumer side yet, because that's a crazy, noisy world, and you would blow all your money, right?
Right.
That's very true.
Right. So we sort of think there's more.
Why don't you connect something like Facebook?
Yeah, no, I think we need to start to do that. We've spent all of our time and effort on the corporate clients, because that's how you get the doctors, right? And so we started there, but we're ready to sort of start to broaden out.
But do the doctors and the providers actually tell their patients or the consumers about Me You Care?
Yes, so literally from within.
How does it work?
Yeah, so within Me You Care, if you were a doctor,
Right.
there's a little thing that's called an invite button, right? And so literally they can ask one of their patients to go get the app. All they have to do is download it and click this one little thing, and they're linked up. And then they can instant message with each other. Think of it like HIPAA WhatsApp or secure WhatsApp, right? So they could send photos back and forth through instant messaging, all secure, or they can send video messages and all that kind of stuff.
It also integrates, because remember, it was designed to overlay, not replace. It integrates into EHRs. So that becomes part of the record in their medical record. So if anyone goes back to review it, the Me You is part of the record in the conversation.
So instead of just seeing something written about, see, this is the big thing. A picture's worth 1,000 words. If you and I haven't met in person and I described you what's wrong with my knee versus I show you 45 seconds of what's wrong with my knee, you got way better information.
So hold on. For a company like I own a hospice and home health company. I like to know what's going on with my patients as well. Is that something that I could use as well?
This is used all the time for that kind of thing. It's called patient status. So literally your workers you'd put a little protocol, which we help you do. You sit there and say, for every patient, once a week or once a day, we're going to take a photo of this, a video of this, and that's going to be sent back to a coordinator.
Wow,
right?
okay.
And so the coordinator is expecting 20 reports a day about 20 different patients, and he or she can sit there and go, there's a little problem here. This one seems depressed, or this one seems like she's not walking properly like she was yesterday. And you can compare yesterday's video with today's video and say they're better, they're worse, right? And then you can even send that in our system to a specialist or a doctor who can sort of triage the information. So you guys can sit there and go, yesterday Mrs. Jones was doing pretty well, but it seems like she's not doing as well. Let's get a doctor's opinion, right? So you can run a very efficient sort of practice or company from that perspective.
Wow.
Well, then it applies a human
for sure.
element, which means somebody has to actually follow up and do it.
Yeah.
I mean, the app is there, the technology is there, but they have to
have
do it.
users, exactly.
They have to,
I mean, I have nurses to do it.
Yeah, you've got a professional staff, which
so
is exactly
I have
right.
nurses, social workers, we have everything.
Yeah, we have folks, we have all those categories of users because they exactly. Think of fall risk, right, and which is one of the big things. Two-thirds of senior patients fall within 3 weeks out of getting out of the hospital. I mean, it's a big deal, right? They're old. There's a slippy, slidey rug. There's no grab bar. The toilet's too low. I mean, basics, right? This isn't rocket science. This is basic health, right? And so, again, imagine if someone goes and does a little pre-check on the facility or on the room or on the walkway to the room and says, there's loose stones in the way. Or we had one situation where there was no grab bar in the shower, right? So they took the photo of it and they sent it to the son-in-law. Well, he went down to Home Depot and for $10 he gets a grab bar
and installs it.
Mom's not going to fall.
Yeah.
Wow.
Again, dumb stuff, powerful stuff.
Yes,
right?
Very true.
What's your hopes for MeUCare? Where do you want to see it go?
I just want as many people to use it as possible. That's the honest answer.
How do we tell everybody how to use it?
www.meucare.com.
And download the app.
Or either App Store, Google Play, or the iOS App Store. Go and look up MeU MeU space care.
Care.
It's
MeUCare.com. www.meucare.com.
Yeah. It's MEU.
MEU.
Yeah, exactly. CARE.
Okay.
So
Actually, I had someone earlier that sent me a message.
Yeah. For Steve.
Not for
for you.
Steve.
What about the glitter?
The glitter's cute.
I have a question basically from Dan. He's from San Francisco. He said, how can we get people to use emergency only for that purpose? Can MeUCare direct people to regular doctor visits or urgent care?
Yeah, so that's a great question. So Healthcare Partners uses MeUCare because they have regular doctors. It's a doctor's organization, right, provider organization. So they would much rather, because they're at risk, they'd much rather go to one of their doctors if you're a patient rather than run to the ER. Right. So it's a right-on question. So the answer is you go to the app and you've got a message from your doctor. It's encouraging you. Remember, if you've got signs. One of the big things is one of the best ways to keep someone out of the hospital is to go to your doctor's appointment.
Right.
Too many people don't go. Probably partly why maybe not a good experience. Maybe they had to wait 2 hours. Again, human stuff, right? If we don't acknowledge human stuff, we're going to fail at health.
Well, I asked the doctor if he would pay for my time while I was waiting.
There you go. I've said that before. I've said that. I said, you really don't want to know what I make.
Right,
Same
here.
Not at a startup, but I'm saying, you don't want to know what I make in real life, And so it's like, they're like, I'm like, want me to charge you?
He didn't like it, but
I wish
said
I could say that. I think I'm too nice.
No, but you want to these days because it's your time.
Yeah, I hate to be waiting.
So the answer is to that question is definitely to know who your doctor is, have a relationship so you get the patient to want to go to that doctor's appointment, and then they won't just run to the ER, which is really good.
Absolutely.
Very good.
So I know that you were going to invite them to come to Nina.
Yes,
so
I have a
concert. You want to talk about that right now?
Concert on April 8th. It starts at 5 o'clock. It's the red carpet, and then we're gonna do at 6 o'clock. We're gonna do an auction, and then the live show starts at 7. So
tell them where to find Nina.
Facebook, ninasoulsiren.com, and also you can find it at my cubeyandcompany.com page. And Facebook page as well.
And you gentlemen are going to join us, right, for a
yes,
concert? It's going to be an amazing concert.
Cool.
Abby's going to be performing as well. She's going to do a couple of numbers.
Very nice.
And let's talk about this.
And we have MSM Luxury Estates, which is offering between now and when? Between now and the end of
April 15.
Between now and tax day, April 15.
There you go.
Yes, MSM Luxury Estates will pay you for your escrow and title costs.
I like that. So if anybody wants to buy or sell,
that's a good deal.
For MSM Luxury Estates, actually it's thousands of dollars.
On a real house. That's
on a real house.
On a California house. That's
on a California house. That's a lot of money. But anybody that wants to buy or sell, they get their escrow paid for. We get their title paid for, and of course they get the white glove service. Abby will personally take you out there, and you get to deal with Abby, and she might give you, a little glitter in your eye.
There you go.
Right? A little sparkle in your eye. Gentlemen, it's been wonderful.
Wonderful.
Very
Anybody
informative.
that you want to greet?
Well, we're just hi to the world. Thank you very much. We really appreciate the time. Everybody stay healthy.
Everybody
yes,
stay healthy.
healthy and download Moe Care.
Where are we going with this? Where's healthcare going?
Yes.
Better?
Yes.
Better?
No, definitely better. Yeah.
Definitely better.
Hopefully, or for sure.
No. Human beings stand up for your rights. That's all I have to say. It's like, right? I mean,
don't be afraid to speak out when you're not happy with your care.
Yes.
Interview your providers before you go to them.
That's great advice.
Because it's your choice. So just take care of yourself and make sure you have the right doctor and the right choice. And if you have any questions, reach out to Abby, and she knows how to reach me, and I can help you navigate the system.
And I think that's really good advice.
Steve knows everything.
He does.
He does, right?
Absolutely.
Well, he seems like it. He's CEO, CO. Wait, sorry,
CDO. I have been a CEO.
Everything.
I've been a CEO, CIO.
All the O's.
All the C's and all that stuff.
And all in the medical industry.
All in the medical industry. So
industry.
healthcare is hard to navigate. So if anyone has issues, reach out to Abby, and she'll get a hold of me, and I'll help you navigate the system.
Absolutely.
I appreciate the advice, and I think the point is stand up for your rights.
Absolutely.
Yes.
Yeah.
Absolutely. Do not be afraid.
And if you have one, bring someone with you is the other good thing that we've learned, is bring a loved one or someone who cares, a neighbor who cares about you. That's the second thing, because often you're not listening, as we discussed. They'll listen for you.
Wonderful. MeUCare.com, www.meucare.com. This is how you stay connected. Gentlemen, thank you for being here with us. Abby Cubey, LA After Dark.
Thank you all.
We appreciate you. We'll see you next time.
Thank you.
Thank you, everybody.
You're listening to LA After Dark with your host, Abby Cubey, only on LA Talk Radio.